turning now to some medical news. More than 2 million new cancer cases are expected this year alone in the U.S., according to projections from the American Cancer Society. But cancer death rates continue to decline, thanks in part to the earlier detection of some cancers. A new study finds that rates of cervical cancer screenings remain low across the country. Mandy Gaither speaks with the senior author about the troubling trend.
First, the good news. Newly released research shows screenings for both colorectal and breast cancers have rebounded from declines during the COVID-19 pandemic. But researchers say that's not been the case for another cancer.
And unfortunately, we didn't see that for cervical cancer screening, that they are still below pre-pandemic level.
Study senior author Preeti Bondi and her team found past year cervical cancer screening in 2023 remained at 14%, which is below pre-pandemic levels.
We want to detect cancers early when they're more treatable.
And that's why researchers say it's a troubling trend, one that's viewed as a long-term problem as cervical cancer screening started to decline in the early 2000s. It still isn't fully clear why these specific screenings haven't bounced back like others post-pandemic.
Some of the research points to reducing knowledge among women about the need for cervical cancer screening and fewer recommendations to be screened by physicians.
Cervical cancer screening recommendations vary based on age and health, but the U.S. Preventive Services Task Force says if your age is 21 to 29, get your first Pap test at 21 and every 3 years after. If your age is 30 to 65, there are options. Get tested for human papillomavirus, which can cause cervical cancer, every 5 years, or an HPV Pap co-test every 5 years, or a Pap test every 3 years.
New American Cancer Society guidelines recommend cervical cancer screening start at age 25. The Trump administration dropping a lawsuit aimed at protecting emergency abortion access. The Biden-era suit challenged Idaho's restrictions. The Supreme Court had temporarily allowed abortions only when pregnancies threatened a woman's life. The Justice Department withdrew that case yesterday. Currently, 12 states ban abortions at all stages of pregnancy. More Americans are turning to exercise snacks to meet their weekly activity goals. A certified trainer showed the concept on CBS Mornings. Exercise snacking means short bursts of intense activity just for a minute or two throughout your day. Experts say it's ideal for the 80% of Americans who don't meet the recommended 2.5 hours of weekly exercise.
We really want to get away from that all or nothing mindset, because even 1 to 2 minutes, we're not just talking about the 1 to 2. You're thinking about adding this in, so we want to build habits.
Other examples of exercise snacks include walking briskly for 10 minutes, jogging in place for 5, jumping rope for 3, or stair climbing, but sadly, no real snacking is involved.